I apologize. I'm going to try to get through this.
CNN reporter Sara Sidner broke down in tears after airing her report on COVID-19. Now, before I get to this clip, I do want to say that after the clip, I'll be discussing one country that actually took the virus seriously, the steps they took to get their numbers down or never even have an issue with COVID-19 to begin with, and how they compare to the U.S. But before I get there, here's the clip of Sara Sidner on CNN.
She spent more than 40 days in this ICU before walking out alive.
I made it. A lot of days I didn't want to make it, but I did it.
As she celebrated a second chance at life, the ceremony for death was still playing out in a parking lot for the Sesma family.
Don't let this be you. If you truly love your loved ones, don't let this be you. Continue to, take all the cautious, take extra precautions, exaggerate if you have to.
This is the 10th hospital that I have been. I'm sorry. This is the 10th. I apologize. I'm going to try to get through this. This is the 10th hospital that I have been in. And to see the way that these families have to live after this and the heartache that goes so far and so wide. It's really hard to take. I'm sorry, Allison.
Hey, Sara, no apology. No apology needed. We've been watching your reporting on the ground throughout this horrific year. And we have all been struck by the grief, the collective grief that all of us are in. And to see these families who are soldiering through it, who are persevering, and who are having to have these funerals in parking lots, like the ones that you showed us, it is just a collective trauma that all of us are living through. And Sara, we all appreciate the heart that you bring to this every single day, as well as your excellent reporting.
Thanks. It's just not okay. It's not okay what we're doing to each other. These families should not be going through this. No family should be going through this. So please listen to what this family is saying. Don't let this be you. Do whatever you can to keep this from killing your family members and your neighbors and your friends and your teachers and doctors and firefighters. All of these people are here to help you, but you have to do your part.
There is very little journalism left in cable news. Very little. But reporters like Sara Sidner, who go on the front lines to tell these stories, they do incredible work. And oddly, this moment of emotion is refreshing. It's refreshing to see somebody in cable news media, in mass media in general, actually feel connected to the stories that they are telling. This is, part of the reason I think a lot of people feel disconnected from the media, from mass media, is that they don't see themselves represented in it. And you have largely millionaires on television telling you what is going on, not fighting for your best interests. But here you have somebody who actually, is on the ground telling these stories, is connected to the stories that they are telling. And you can see that in her reporting, in Sara Sidner's reporting. So great moment here. Now I want to do a little turn. So she says here, do your part, which is true. Yes, do your part. Absolutely. Physically distance, wear a mask, be considerate of others. That is definitely a part of getting the COVID numbers down. But the biggest piece of it is failed government, failed leadership. It is the responsibility of those in power to keep you safe. And most governments around the world have failed in that regard. So first, of course, I'll show you the COVID numbers in the U.S. These numbers, it's really easy to become numb to this when you see numbers like over 22 million total cases. We're talking here, these aren't just people, oftentimes we focus too much on total deaths, which of course is obviously important. But in terms of total cases, we're talking about pre-existing conditions. Over 22 million people are going to have pre-existing conditions going into the future. So there are long-term health impacts of having COVID-19 that isn't shown in the death total. So this number of 22 million does matter. But 22 million here with total deaths of 375,000. Just unbelievable. And again, it's easy to get lost in massive numbers like this. Now, I want to compare this to another country, Vietnam. Vietnam has 95 million people. They've had 1,520 COVID cases and only 35 deaths. And in fact, a story I'm going to get to from The Guardian that is 2 months old uses the 35 deaths number in their reporting because the number hasn't changed since then. 95 million people live in Vietnam. This is a socialist republic that actually took the steps necessary to protect their people, separated the importance of public health from the economy. So before I get to some of that and exactly what they did, just this from the data we have here. So daily new confirmed COVID-19 cases per million people. This is the rolling 7-day average. This gives you a good idea of how countries compare to other countries. So the UK, of course, right now with their own variant of the virus doing horribly. But up there, of course, the US and Germany and Canada not doing too great either. Every country here has larger second waves, or in some cases, third waves, or fourth, fifth, sixth waves, whatever this is. But Vietnam, 95 million people. That's their line. A massive border with China. They were able to keep their numbers down from the start. Now, let me show you, before I get into some specifics, this article actually touches on it. So from The Guardian here, Vietnam is fighting COVID without pitting economic growth against public health. They go on to say here, during the first phase, the government managed to cut off all the virus transmission routes promptly and comprehensively. Every infected person was hospitalized. People in contact with them were traced to the fourth layer and isolated. Their homes and neighborhoods were put under local lockdown and sanitized by the army. The country has effectively been acting as if this were biological warfare. So let me give you some idea here of what Vietnam did. You got some of it in that quote there, but contact tracing 4 layers deep. Is anybody else doing this? This is how you ensure that you get everybody that may have been in contact with someone who had COVID-19. Contact tracing 4 layers deep. Every infected person hospitalized, homes and neighborhoods sanitized. They don't entangle public health with commercial interests. They separate the two, putting public health first. They went above and beyond the World Health Organization recommendations, and their plan was implemented a month before the World Health Organization declared it a pandemic. So Vietnam is now seeing, in fact, positive GDP growth. So if the economy was your biggest concern, the way Vietnam handled it was the way to do it. Public health above anything else. Again, this is a socialist republic, 95 million people, only 1,500 cases and 35 deaths. So it's not just about personal responsibility. It isn't just about ensuring that you are being safe and wearing a mask and physically distancing, but also about government responsibility and how they do or don't protect their society.